All right, guys and gals, let's continue the discussion with the female anatomy. The female anatomy, generally speaking, is the more complicated of the two genders. Most textbooks have much more information dedicated to the female anatomy, and because the female anatomy is so complicated, this is one of the reasons why you can, if you go into the medical field, you can receive a specialization or certification in women's health. We don't need certifications in men's health, not because we're sexist, but because men, generally speaking, are simpler and don't have as many complications associated with their reproductive tracts. If we look at the female reproductive tract, the external genitals of a female are known as the vulva, and this has been a pet peeve of mine. I remember when I was coaching football and wrestling and so on and so forth, and I'd hear the locker room talk. Guys would refer to the female external genitalia as the vagina. Oh my gosh, it's the vagina. I saw her vagina. No, you very rarely see someone's vagina. You have to look very closely to see the vagina. Many times what young teenage boys who are poorly educated mean when they say, I saw her vagina, what they really mean is, I saw her vulva, which is a generic term that collectively refers to all of the external female genitalia. Those genitalia included in the term vulva include the labia majora, the labia minora, the mons pubis, and the clitoris. If we look at the genital tract of the female's reproductive anatomy, we can start with the vagina. This is the tube that receives the penis and semen, and then we will merge with the cervix. Let's go forward a couple slides here. This will make it a little bit easier. We'll start with the vagina, and that vagina is the tube that the penis goes into, and that and babies come out of as well, I should also mention. That goes without saying, I guess. And then at the deep portion of the vagina, superior end of the vagina, we have the opening to the uterus. This opening of the uterus, or neck of the uterus, is called the cervix of the uterus. And then, if we flip to this anterior view, we can see the cervix of the uterus right here. We have the main body of the uterus, and then we have uterine tubes, also known as oviducts, or if you're crusty like me, you were taught fallopian tubes. And those uterine tubes then go to an ampulla, which then terminates with a bunch of little fingers known as fimbriae that wrap around the ovary. And the ovary is what will release the egg that is picked up by the fimbriae, carried into the ampulla of the uterine tube, into the uterus itself. Here we can see this fold of fat, or this fatty deposit, on the anterior portion of the pubis, or pubic bone, or pubic symphysis. This fatty deposit is known as the mons pubis. Quite literally, the pubic mountain, if we were to look at the Greek, or the genital mountain, if we were to look at the Latin or root words. The mons pubis serves a very important function. This mons pubis serves to cushion the pubic bone during sexual intercourse. Here we can see the female external genitalia, collectively referred to as what? As the vulva. There's the labia majora. This is the big lip. The labia majora is going to be lateral and will typically have pubic hair on it. The labia minor, the small lip, is going to not have any pubic hair on it and will be much more sensitive. This labia minora is going to have a lot of mucous membranes associated with it. On the anterior portion, directly inferior to the pubic bone, we have the glans clitoris. This glans clitoris, or clitoris for short, or clit if you use the slang term, is going to be a small segment of erectile tissue. Yes, females do have erectile tissue. The labia minora and the glans clitoris contain erectile tissue that can become engorged with blood when the female is physically aroused. The glans clitoris is developmentally analogous to the glans penis. So when we think of the head of the penis in a male's anatomy, or a male's reproductive tract, and all the nerve endings that are located in the glans penis of the male anatomy, there are the same number of nerve endings located in the glans clitoris of a female's clitoris. The difference between the two is that the clitoris is a much smaller structure, so there's a much higher concentration or a higher density of sensory nerve endings in the clitoris compared to the glans penis. Yep, I covered all the structures. As we look at, let's see here, the ovaries. These ovaries are going to produce secondary oocytes, commonly or colloquially referred to as eggs, that are then brought in. Here we go, there's my mouse. brought in through the ampulla to the uterine tube. Usually, if fertilization occurs, that fertilization is going to occur within the uterine tube, and then the egg implants, or the fertilized zygote will implant into the inner lining of the uterus, in the main body of the uterus. Ideally, it'll be on the side wall of the uterus. Occasionally, it implants right at the opening of the cervix. That could cause a condition known as placenta previa. That's not necessarily a very good condition, and we want to avoid that. So that hopefully that fertilized zygote implants on the side of the uterus. The inner lining of the uterus that is implanting or receives that fertilized zygote is known as the endometrium. So, guys and gals, let's have a concept check. The female external genitalia are called, I should have put an ED there. Sorry for the typo. Oh, I have tons of typos on this PowerPoint presentation. Shame on me. There we go. Boom, boom, boom. Back to full screen. The female external genitals, are called the vagina. True or false? Go ahead and rewind the video to get me an answer, or check your textbook, or check your notes. 5, 4, 3, 2, 1. The answer is false. The collective term for female external genitalia is the vulva. V-U-L-V-A, not the vagina.